Vanakkam, Namaste and welcome to Dr. Shah's Clinic. In yet another video, we are going to discuss on a very interesting and enticing topic. It's going to be sexless marriage, and this is going to be a two-part video. We're going to discuss on sexless marriage. The first part of the video is going to be what is a sexless marriage, what are the causes of sexless marriage in the part 1 of the video, and part 2 of the video is going to be primarily on how to treat a sexless marriage. So sexless marriage is basically a condition. It's not a clinical condition. It's basically a specific circumstance or a situational circumstance where sexual intercourse is basically not happening adequately between the couples. So if the frequency of intercourse is very low, if successful sexual intercourse which involves penetrative sex along with intravaginal ejaculation does not happen at all, where sometimes couples do just foreplay and then the erection goes, the individual loses erection, or the woman may have pain during intercourse, and penetrative sex basically does not happen at all. These couples are said to have or said to suffer from what's called as a sexless marriage or non-consummation of the marriage, which is also called as NCM. Now, sexless marriage in general can be very distressing for both the male partner as well as the female partner. And the reasons are quite obvious, because in a marriage, if there's no sexual intercourse, what's basically going to happen is there is going to be frustration. The frustration is basically more for the female, because women tend to feel tend to find themselves extremely distressed. They find themselves, both women tend to go through extreme degrees of clinical depression. They just sometimes develop anxiety problems. They develop negative image about their their body overall body image. They develop a negative thinking, and they think maybe their partner do not find themselves attractive enough, or a lot of things. Disturbed body image is commonly seen in women combined with clinical depression, doubts about extramarital affairs, and lots of problems. Basically women go through emotional turmoil when basically faced with the situation where they're not receiving or adequate sexual intercourse is not happening in the marriage. With respect to men, it's equally distressing, but basically with men, at least what we have seen in certain couples with sexless marriage, they're upset, right? So men are definitely going to be upset, but because large proportion of men involved in masturbatory behavior, what happens, they have a sexual outlet anyway, at least with respect to our Indian subculture, but women may not have adequate sexual outlet. So the masturbatory behavior kind of compensates for the lack of sex between couples in a sexless marriage. And with men, basically what happens is they feel their disturbed body image, they feel their confidence is lost, they completely lose interest in sexual intercourse in some extreme instances, and they're not able to adequately sustain their erection. So with respect to sexless marriage, what are the causes of sexless marriage in men, and what are the causes of sexless marriage in women? This is what we're going to see first. So the causes of sexless marriage in men are commonly conditions like, first, some men may have severe erectile dysfunction. It might have not been treated before the marriage, and if men have erectile dysfunction, which is defined as the inability of the male to sustain his erection to allow satisfactory penetrative intercourse, the man will not be able to engage in sexual intercourse. He'll try a couple of times, and after that there'll be a general avoidance or complete inhibition of the individual's desire as far as sexual intercourse is concerned. So he will not even try, he will not even attempt. The woman or his partner, intimate partner, will be initiating intercourse, but he will not be able to get his erection because of generalized anxiety problems, performance anxiety, and worry about his ability to sustain the erection, and he will not try. So erectile dysfunction is probably one of the commonest causes of sexless marriage with respect to men. The second causes of sexless marriage is hyperactive desire disorder, sexual desire disorder. Some men, about less than 5% of men suffer from a condition called hyperactive sexual desire disorder. And over here, what basically happens is the individual may have elevated prolactin levels or elevated estrogen levels in the bloodstream. There may be a hormone imbalance. There may be, it could be the patient could have a testicular failure. It could be any condition. And the overall desire and overall libido or overall interest towards seeking sexual intercourse will be very less. So these men again will not, these men don't avoid intercourse, but in general, all forms of sexual activity, they will not show any interest at all completely. So they'll be just going for work, coming back, sleeping in the night, going for work, coming back, sleeping in the night. And these men will also, peculiarly have, occasional, prone masturbatory behavior. So they engage in prone masturbatory behavior, or as and when they get a bout of interest coming up, they choose masturbation over penetrative sexual intercourse occasionally, and that itself will be very rare, once a month or once in 10 days, once in 20 days. So generally there will be complete avoidance of sexual intercourse. That's the second cause. A third cause of a sexless marriage in men is probably masturbatory addiction or pornography addiction. Now, the biggest problem with masturbatory behavior is if it's controlled, it's a different thing altogether, right? But what basically happens is because the explicit sexual material or pornography that men tend to see on the desktop or the laptop or the cell phone is so enticing, and because you get a variety of women that you can technically look at and masturbate to, it's in general the arousal that men get from pornographic content is technically or medically or not medically, it's technically higher as compared to sexual intercourse with one stable intimate partner. So because of the variety that they get there, basically what happens is some men tend to get addicted to the habit of masturbation. And basically what happens, once men get addicted to masturbation, the masturbation is more enticing, it's more interesting, it's more motivational than trying sexual intercourse with their partner, and that's another reason for sexless marriage. Now in some men, what we have seen clinically, in our experience in our clinic, is prone masturbatory behavior. Now we'll make a separate video on prone masturbation, but some men tend to rub their organs or genitals on the floor, on the toilet seat or on the bed, and they practice this over a protracted or a very long period of time from the time they probably go through puberty. So they start at 13 or 14 years of age and they do it, and accidentally, and basically what happens is the brain rewires in a way where they get only aroused when they practice the specific behavior of prone masturbation or rubbing on the bed masturbation, either on the floor or on the toilet seat or bed. And that can also result in a generalized lack of interest in sexual intercourse. So sexless marriages are very, very hard because it's not just the sexual intercourse. The problem is, if there's no sexual intercourse, the fertility is also not going to happen. That is, the ability of the man to father a child or the woman to bear a pregnancy is also going to be severely impaired. And basically what happens is, with fertility clinics, when you go to a fertility, the objective of the clinic is to give you a baby. So the sexless marriage part is not resolved, but patients tend to sort out, if it's been 2 years after marriage, 3 years after marriage, the couples are under tremendous social pressure, and basically what happens is the fertility part is sorted out with IUI or IVF. But what happens is once the child becomes big, right, the child grows to 2 years of age or 3 years of age, the problem tends to persist. So the sexless marriage still remains a sexless marriage. Just because a child is born, it does not mean that sex is going to happen automatically between the couples. So very, very difficult condition to treat, very, very tricky, has to be managed first before solving the infertility or the fertility problem that the couple has. So the common causes of sexless marriage in men, to summarize it, on the right are going to be erectile dysfunction, prone masturbatory behavior or masturbatory addiction with pornographic addiction, hyperactive sexual desire disorder, and the last condition is a condition called alexithymia. Now in men who have alexithymia, basically what happens is there's something wrong with their empathy circuits, and it has a neurological origin. So the patient might have had would have had a head injury or would have some other injury, or there's something that's going wrong from the psychological perspective. So in men who are diagnosed with alexithymia, there's something wrong with their empathy circuits and they cannot empathize with their partner, and sexual intercourse usually does not happen in these men. We have seen a couple of patients with alexithymia in our clinic, and it takes a long time to manage and treat such patients. So these are the common causes of sexless marriages, with respect to men. Now, with respect to women, right, less than 5% of the time or less than 3% of the time, you can attribute a sexless marriage because of a clinical condition in the women. And the commonest clinical condition that we see at least with respect to our Indian population, with respect to women, is a condition called vaginismus. Now, if you look at the photo on the right, what basically happens in vaginismus is, the woman has a fear of sexual intercourse. So the second the man tries to penetrate, the woman or the female partner will bring her leg together and try to push him away because of the perceived fear of sexual intercourse, and because that perceived fear is associated with severe pain during sexual intercourse. So basically the woman feels sexual intercourse is extremely painful. It's a perception, and it may be painful for her genuinely. So it's both a psycho condition, it's basically a psychosomatic condition. That means it involves both the mind as well as the body. So women with vaginismus do not allow their husbands to penetrate them ever. So what basically happens is, vaginismus basically results in the female partner can result in erectile dysfunction in the male partner, as seen in the image above. So the man will have a good erection, he will try to penetrate. Because of fear, the female partner may make faces or may try to push him away or might close her legs or tighten her lower abdominal muscles. And what happens? The vaginal wall will close. When the man is trying to penetrate, For him, it will be like as if the organ is hitting a brick wall, and he will lose his erection in 2 or 3 minutes. So, sexless marriage, the two cardinal conditions that we try to always diagnose and rule out: first is one, erectile dysfunction in the male, and number two, it's going to be vaginismus in the female. So, the sexless marriage, which is a condition, or the condition that which is basically a dyadic condition, right? It involves two people. In individuals where there's sexless marriage, we strongly recommend the individual to come with their partner for a proper assessment of the condition. We do medical testing where relevant. With respect to the male, we do the male sex hormone assessment. We do a physical examination, estimate organ size. Sometimes we have to also rule out hymosis, because some men, the foreskin on the penis is so tight that they just cannot penetrate because the foreskin is tight, and we have to do a circumcision surgery if required. Give them counseling, and we take them through a whole set of treatments. It takes about a month or so to kind of resolve and treat the condition. This is with respect to men. With respect to women, what we do is we teach them guided penetration. We advise them a woman on top pushing, and exposure therapy as well. So it helps them kind of overcome their fear of sexual intercourse. So what we're going to do now is, I hope you enjoyed this video with respect to sexless marriage. Now, in part 2 of the video, we'll discuss on sexless marriage and its treatment options with respect to both the male and with respect to both the female. So I hope you enjoyed this video. Please like, comment and subscribe. Share this video with all your friends and loved ones. This is Dr. Shah, and do watch the second part of the video, sexless marriages treatment. Alright, see you in the next video. Take care. Vanakkam.